Coolsculpting has become really popular in the last 3 to 4 years, I would say, because it gives patients an option to reduce their fat with little to no downtime. So, comparing it to laser liposuction, which can also be done in the office, but you have a lot more downtime to it. There's little incisions, there's a little bit more risk involved. Coolsculpting, you can come in, sit for anywhere from 1 to 4 hours, depending on how many areas you're doing. Leave out of here walk out by yourself. You don't need a driver. You don't need to take any medication before you come in. You're walking out of here feeling the same way that you did when you walked in. To recover from Coolsculpting, you're looking at maybe a week or so of discomfort in the area that we work on. Nothing to where it would require any kind of pain medication. What you can do is take ibuprofen to help with any kind of discomfort, but for the most part there's really no downtime to it, so you walk out of here feeling the same exact way as when you walked in. The charge for Coolsculpting is typically by area. So if you're looking to do, lower abdomen is typically one area, upper abdomen is an area, flanks is also an option, so flanks is typically your love handle area. We always do inner thighs, outer thighs, so those are all the main areas that we use for Coolsculpting. All of those do have FDA approval as well. So the cost per procedure is normally around $1,000 or so per area. If people decide they want to do more than one area at a time, there's always an option for a multiple area discount as well. For Coolsculpting, there's really little risk involved. As you saw when I put the applicator on Janice, I used that cold gel pad. That cold gel pad really eliminates any kind of risk for anything, for any skin burn. It protects that skin from that applicator so that there's no chance of us freezing the actual skin. We're just penetrating those fat cells. Sclerotherapy has been around for 20 to 30 years, I would say. Over the last 5 to 10 years, it's really come a long way in a sense that we have FDA approval for the actual medication that we're injecting into the spider veins. So we use a product called a Sclera. A Sclera is one of 2 that's FDA approved to inject into those spider veins. It's a polydocanol solution, so basically what it's doing is it's getting in that vein lining and it's irritating the vein lining and fading it away over time. They describe it kind of like a vein detergent, so it's going in there and just kind of rubbing those veins, the walls of the veins and fading it away. With that said, it still does take multiple treatments. There is nothing that has FDA approval that it's a one and done treatment. After sclerotherapy, the vein is actually gone. A lot of the times these veins have a deeper connection to them, so one thing that we always make sure that we do with all of our patients is make sure there's no underlying disease involved. So Dr. Mountcastle performs several varicose vein procedures a year. What we're looking for is making sure that everything deep in their veins has good flow before we just go injecting the superficial cosmetic spider veins. So a normal treatment, if somebody were to come in and present with spider veins, we would just do a quick ultrasound on them just to make sure everything looks good deep in their system. If we did find something, we always do recommend that you do your varicose vein treatments first. While varicose vein treatments and spider vein treatments are not directly correlated, we oftentimes do see a lot of people with deep problems also have that superficial sclerotherapy needed. The cost for sclerotherapy is priced per session. So normally we price the session at a 30-minute session. It can range, from $300 to $400 depending on how much solution is used, if a little bit extra time is needed. The great thing about sclerotherapy is that as you continue the treatment on, the price does reduce significantly. Once you become more of an established patient into our system, we have nice touch-up sessions too. As I kind of mentioned earlier, sclerotherapy is maintenancing. So, even after that 3 to 5 sessions, it is recommended that you keep up on it. You do 1 or 2 every year or so, just to make sure you don't get right back to where you started. It's much easier to maintenance them once or twice a year than to come back, in and do a whole nother series of 3 to 5 of them. Sclerotherapy has some risk involved with it. I would say one of the more common risk is something called staining. Staining can come if adequate compression is not applied after the procedure. That's why it is so important that you wear your compression stockings for 5 days after each treatment. The staining is not permanent, which is a positive, but it can last for 6 to 8 months or so. The staining kind of just presents like a little bruise. Any other risk involved are your normal risks. So, you're looking at probable bruising, a little bit of swelling, a little bit of discomfort, but overall it is a very safe, minimally invasive procedure.